Alright, today we're talking about sedatives and hypnotics. So, just to define it super quickly, the same drugs are what cause the sedative and hypnotic effect, and the only difference is that at a higher dose, you would experience a hypnotic effect. A sedative essentially refers to a calming, anxiolytic, meaning anti-anxiety effect. And the key thing is that there's no effect on mental function, so they're still capable of answering questions, but just appear more relaxed and may not remember what is going on after the fact. Hypnosis involves drowsiness and the maintenance of sleep. And often we see this in a spectrum of sedation where hypnotics are called deep sedation, when hypnosis is the goal of sedation. The mode of action of some of these sedatives involves GABA, which is a receptor on the surface of cells. The GABA A receptor essentially causes chloride influx, hyperpolarizing the membrane, which reduces the possibility of an action potential from firing. Because, well, yeah. And it can act in different places for different effects. For example, the amygdala is responsible for um, sort of this the fight and flight anxious response. So acting here will cause an anxiolytic effect, and um, the two main drugs we're going to talk about are benzodiazepines and barbiturates. Benzodiazepines essentially are allosteric, well, both are allosteric modulators, which means it binds to somewhere other than the receptor site, but obviously they're different drugs, so they bind to different allosteric regions. Uh, it's an agonist, so it essentially like reinforces the GABA function, further reducing action potential firing. Um, so the examples here are midazolam and thiopentol. Midazolam is like we mentioned, how it's a spectrum. It can involve deep sedation, works in 5 minutes and lasts 1 to 6 hours. It's important to know that it's split into short acting and long acting. So temazepam is short acting, diazepam is long acting. So I mentioned earlier that the effect depends on which part of the brain it targets. So diazepam is an anti-epileptic as well, since essentially epilepsy is irregular firing, so it reduces the chance of firing. Thiopentol is a barbiturate that is ultra short acting, and it is important later on when we talk about induction of anesthesia. One key characteristic is that it doesn't have a ceiling effect, meaning that it sort of has a linear dose response, and the dose effect doesn't plateau. So you have to be careful when using it. General anesthetics are the next step in the sequence of putting someone to sleep so that we can operate on them in surgery. The mode of action is something like this, where essentially at the end of the day, we reduce the ability to fire an action potential. And there are a couple of concepts here that are important to understand. The first one is minimum alveolar concentration. So MAC refers to the concentration of the anesthetic gas that immobilizes 50% of patients. The lower the MAC, the higher the potency. It kind of makes sense that if you only require less gas, that means that the gas is more effective or more potent. This means that it has higher solubility. Here's a table of different anesthetics and the corresponding MAC, and methoxyfluorine has the highest one, nitrous oxide has the lowest potency because it has the highest MAC, because it requires the most concentration. Lower the concentration, uh, higher the solubility also means that there's more diffusion occurring in each compartment space. This is a tricky concept to understand. If you look on this diagram on the right, it sort of displays it a little bit better. The idea is that if the anesthetic is more soluble, it will spend more time diffusing since it has more capacity to diffuse through each compartment space. This means that in the rate of induction is slower, actually slower for things that are more potent because it spends more time diffusing into each compartment. Another idea is that the partial pressure within each compartment is important for diffusion across compartments. So if you have more diffusion into the compartment, it makes sense that it's sort of more spread out, so you won't have as much of an incentive to move into the next compartment. But the main idea that I want you to get out of this is that the lower the MAC, the higher the potency, and the higher the potency, the slower the induction. So nitrous oxide actually has the fastest induction rate. This goes both ways as well, and the higher the potency, you actually have um, slower the recovery. So you get slow induction and slow recovery with something like methoxyfluorine. But nitrous oxide, you'd recover very quickly once that anesthetic is no longer applied. All right, so practically, when we're using anesthetics in surgery, we need to induce them into the state. Um, we use induction agents. Induction essentially just means the start of the anesthetic functioning. But the purpose of IV induction agents is to bridge into general anesthetics. We need this so that we can appropriately manage the airway. Um, because once we start GA, this causes diaphragm paralysis, and we need to have them intubated by this point. So we can't really give them GA and then we can't intubate them before GA, but if we produce a state that like a induction agent does, we can intubate them, get them ready for general anesthetic. Uh, we can use thiopental as we discussed earlier as an IV induction agent. Other IV anesthetics include propofol and ketamine, which are often used to bridge into general anesthetic. Note that it is IV, so it allows us to play around with the airway um, as we give this. Propofol is the main one, modulates GABA as well. Ketamine is another one, used in more children, as it's shown to have a low risk of respiratory depression. And here's a quick slide taken from your lecture, um, just regarding the different names. It's important to know some of them and also know some of the precautions as well. Methoxyfluorine is, you might know it as the green whistle, often given in emergency situations as an analgesic, but it also has a sub-anesthetic dose. And that's the end of this.